I'm with the surgery team. This is our entire crew. Who am I talking to?
You're talking to my sister.
Oh, okay. So Miss Smith, she's got a condition where there's a mass in the duodenum, and from all the work that they've done, it seems like it's what they call an adenocarcinoma or a cancer. And the main symptom it's causing, it's blocking everything from going past the stomach. So that's why you've been throwing up for the past 6 weeks. All right. This mass may be resectable, meaning we can take it out with surgery. It may be requiring chemotherapy beforehand too to shrink the mass and make it easier to remove with surgery. In the meantime, it'd be probably best to get you home with your support system, your family, and to surgeons and oncologists who you'll be able to access to, frequently, versus treating all these things out here. You're healing from surgery all by yourself, not having a support system or access to, pretty much daily things that will be helpful for you to heal. So in the meantime, things to get you home are we have two goals. The first goal is, one, to keep you from throwing up all the time. And even if you're not drinking or eating, your stomach's going to be making all these juices on its own, and it's going to be backing up like it has been for the past 6 weeks, and you feel nauseous and you throw up. Second thing is, we want to get you fed. So the way we're going to do these two things is, one, we're going to place a tube surgically through the skin into your stomach, and this will allow us to drain anything coming out of it, okay, into a bag, and it'll kind of tape it to your side. And this way you can drink for comfort, so you won't have dry mouth. You can drink some liquids and it'll drain out that way, because none of it's kind of passing through. And the second tube will go straight into your small bowel, and this goes through the skin also. And this will allow us to feed a liquid formula into your bowel to get nutrition, to gain back some of that 30 pounds that you lost and make you a little bit stronger. All right, and this will allow us to get you back home to Florida and set you up with the oncologist and a surgeon, and we'll send all the results of all the work that we did here, including the imaging and all the lab tests. Okay, and probably back home would be the best option for you to get anything definitive done for this.
If I'm able,
Mm-hmm.
and yeah,
Okay.
that's fine. But this surgery you said we're putting in the tubes.
Correct.
When would you do that?
So we could probably do that pretty soon, maybe early next week, or what do
How
you
long
have
are you
to
here
pay
for?
Huh?
How long are you here in
As
Hawaii?
long as it takes.
Mm-hmm.
Do you have tentative?
I mean, my cruise is gone, so.
Yeah, they
okay.
left us.
So you're gonna be flying home.
Yes.
We have a round trip ticket going back from San Francisco on the 13th.
From San Francisco to here? And
No.
to Frisco.
From here, we need to go fly
But
to
we're
San
gonna miss that.
Francisco
We can forget about that.
to take our.
The cruise was from San Fran to here and back to San Fran.
Yeah.
The flights.
We can fly home.
All right. So
But I do have a cousin that lives in San Fran, so we could fly there. It's just like a short trip. You know what I mean? So.
Today's Thursday, the 8th.
Well, I can look and see if there's any availability in the morning tomorrow, and try to get you in and get this procedure done. Then we can get rid of this tube in your nose.
Oh, God, thank you.
But you'll have two tubes here, which is nothing compared to this.
Okay.
So if we can get you in tomorrow, we will.
Okay.
Otherwise, Saturday's another day.
Mhm.
Sunday.
So you're the surgeons?
Okay.
Well, I told them to send some good-looking surgeons.
And they
Thank
didn't
you.
fail, yeah?
Yeah,
So
yeah.
they send you 3 beautiful.
Yeah, and then one gorgeous.
Oh.
Oh.
You know how to get me, yeah? All right, so are you okay with that plan?
I'm good with that plan, yeah. The sooner the better.
Sure. And you're right, the sooner the better.
Because that will even take a few days to heal before I can even fly, right?
You can fly within a week.
Within a week?
Mhm.
Okay.
As long as we're not dividing
Yeah.
bowels,
Oh.
putting them back together.
Another question I had,
Mhm.
you said something about putting a tube down the small intestine,
Yeah, it's
and the endocrinologist, she told me
Mm-hmm.
that she couldn't get through the mass was blocking
Yeah.
everything. So how do you do that? I mean,
Let
you
me
have a way to do that. I
show
mean,
you
I'm just saying.
Picture. So So I always think pictures are a little bit easier.
Oh,
We
yeah.
can see visually, and so right now, your mass is. This is so you eat, food comes down your esophagus and into your stomach. It goes here and goes in this jumble, a small bowel, out your colon, and you end up pooping it out.
Okay.
Right now, the mass is kind of right about here. Okay. So you're eating, it gets stuck. It doesn't ever go past this point.
Right.
So what we're going to be doing is we're going to be putting one tube kind of right through here. It would come out the skin this way. This drains everything over here. Okay, so things that get backed up will drain out through this tube. And then we're going to go past where the blockage is, probably somewhere in the small bowel over here. Take a tube and put it out through the skin also. This way, we can give nutrition, go through all of this, so get all that nutrition absorption and come out the end. And anything that gets backed up that you drink or normal juices that your stomach make will come out through this tube that way.
Okay.
It's kind of draining and feeding on both sides of that mass.
Oh, okay.
Okay. Yeah. And these are kind of, like we're saying, our goal is to be able to get you home for something more definitive.
It would probably be UAB, not
In Birmingham.
not Pensacola.
Okay.
Yeah. I have a home in Gadsden, Alabama.
That's where all our family
Oh,
lives.
yeah.
So
So that'd be great. I mean,
Yeah.
over here they have a great hospital and great services there too.
Yeah.
Be able to take good care of
UAB
you.
is great. So, okay. What else?
So in the meantime,
You getting
probably
me a pizza?
no, I will not go out with you. Quit asking me.
this guy.
Sorry.
So if we can set it up for tomorrow, you've already have
She's
not
married,
eating.
actually.
Quit telling people that, Victor. She's kidding.
So in the meantime, we're getting your consent form, making sure there's operating room time for tomorrow. This procedure will be done under general anesthesia, so we'll be putting you to sleep, putting a breathing tube in the meantime, okay? Otherwise, there's not too much more than that. Nothing you have to prepare for. We'll kind of take care of the rest. Just get a good night's rest. Okay?
But you'll let me know for sure if you can do it tomorrow.
Yep, we'll let you know for sure.
That morphine will help you rest tonight.
Yeah.
And we'll get a consent form to kind of go over all the risks and benefits of surgery, go over that with you, and kind of giving us permission to do this procedure. Okay.
Good.
Any other questions or concerns?
So,
No, okay. Well, we'll have
Don't
someone
ask
from
me
our
that
team at
again.
24/7. Other good-looking people too. So if you have questions, get the nurse and they'll give us
I
a
don't
call.
care what they look like as long as
Alright.
I
they have
do.
steady hands.
Yeah.
Hey, and the knowledge.
Yeah,
We're here for
everybody's
you,
so
okay?
friendly and couldn't ask for a better hospital right now.
I'm glad you guys feel that way.
We do.
All right. So I'll be back in a little bit. We'll grab the consent form.
Thanks.
Okay.
Thank you.
Okay, see y'all.
Bye.
Bye.
Thank you.